Well, hello, welcome. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center. This program it's a new you for 2022. And we've got some sponsors. We're so grateful for Nash Healthcare and for Nash UNC Healthcare and for Boyce Willis Clinic and the Y for sponsoring this. And we are all about what's going on in our community and what's going on in our health and how we can take hold of what we need to make us healthier. Tonight I have Patrick Ignacio with me. He's a registered pharmacist. He is the owner and operator of Ward Specialty Pharmacy, which is a compounding pharmacy, which is different than your regular pharmacies, and we'll go into that and explain to you what the difference is. So welcome, Patrick. It's good to see you. Glad to have you with me.
Thank you, ma'am. I'm grateful that I'm back here, and thank you for the invitation.
It's been a while.
It's been a while, but I'm so excited because it's very timely.
That's right. So we're going to be talking a lot about things that Patrick can offer primarily, for good health as a whole. But, you know, I think what's on everybody's mind is the Omicron, the COVID. What do we do? How do we keep safe? How do we keep from getting it? And so Patrick's got a few ideas to help us boost our immune system and help us to fight off this horrible virus. So Patrick?
So yeah, I mean, first and foremost, I mean, we wanted to discuss what's going on right now, right? So we have this, you know, Omicron, and one interesting thing is that there are sub-levels now, Ms. Linda, you know that the Omicron actually is very unique because they have this new sub-level wherein it has a stealthy characteristic, meaning even you have the symptoms, you still can become negative. So that's the thing with this one, and that's why, you know, we want, what we're actually, the reason we're here is, you know, to tell the public, you know, on how can they be more proactive. So, and that's the thing right now. What we wanted is actually, you know, to work more as a community, and we need to, you know, work hand in hand in fighting this Omicron COVID thing. It's not only just, of course, your doctors or your practitioners, but it should be you know, a working hand in hand between the patient, you know, your pharmacist and your doctors. And this way, we would actually help minimize, you know, people from going to the hospital, or as much as possible, even, you know, preventing them from, you know, having that. One thing, Ms. Linda, I mean, this past Monday, I mean, I got a sad news that one of the customers was actually very healthy, and I think, I mean, he's also vaccinated. Unfortunately, I mean, he passed away, according to the wife, because of COVID. So one thing that I actually noticed is that, again, I mean, if we're not prepared and we're not proactive, then the chances of having more severe is actually there. So the description is like, you know, I mean, it's like preparing a war or in a battle. So the more armaments you have, the more prepared you are, the survival rate is actually more.
That's right.
And I'm sure you agree with that as a practitioner, right?
And I'm all about proactive. We can't be reactive. We have to be proactive. We have to fight against it. We have to eat well. We have to exercise. We have to keep our bodies healthy in all ways. And eating and exercise is certainly two of the ways. Taking good pharmaceutical grade supplements is a way. So what are some of the supplements that seem to be helping people that either have the virus or want to not have the virus?
Again, and again, I thanks for, you know, putting a disclaimer here. So because again, there's a lot of supplements that you can actually, you know, use. Number one, to fortify your immune system. We're not actually telling the public that, oh, once you started actually, you know, taking the supplements, it would actually cure or can actually, you know, prevent this one. So what you're trying to do is actually to fortify your immune system. And let me start first with viral load, okay?
Okay.
When we have the virus, what you're actually trying to prevent is, the viral load. The more viral load that you have, meaning, the amount or the concentration of the virus in your body that gets in, then the chances of actually, having the COVID is actually there. Now, always remember that, when people are not dying really, specifically for COVID. Most people are actually dying for pneumonia, right? So that's one. We're actually, trying to prevent that. And the thing is, again, the first thing that you have to do is to prevent that from getting into your lungs. So that's the reason why you guys are, asked to wash your hand at the same time, use the mask to actually, lower the viral load. But one thing also that I wanted you guys to know is that you can also do something that's very, very cost effective, and that is actually using a spray. So I brought something like this. Is a nasal spray. It's called X Clear. So again, I'm sorry that I have to mention the brand, but the thing is there is actually xylitol in there. What xylitol is doing, it has the property of antiviral and antibacterial property. So what you're doing is that every time that you will be going to a crowd, or a big crowd, you can actually use that, to spray your nostril. And the thing is, this is safe to be used by pregnant women, children. I have my 7 years old son is using this spray. So every time he goes to, to school, he sprays, his nostril. And the purpose of that, it's like washing your hands.
Sure.
So you're washing your nostril and your throat so that it lessens actually, the viral load. And it's very, very affordable. It's only like, between $12 to $13. So that's another way.
And this lasts a long time.
Right. That's another protection that you can actually use in addition to wearing mask. Then the second thing is that most people are using the vitamin C, vitamin D, zinc, right? I mean, that's great. The problem, again, guys, is that make sure you're taking the right dosing.
Right.
Because if you're because there's a lot of questions that, can I just use my multivitamin? Well, the problem with multivitamin is that it has a very, very small amount. And what you want right now is to superdose in order to fortify your immune system. And what else that you can take? You can actually, take glutathione, and you've heard of quercetin, but I'm actually, an advocate of glutathione, because the glutathione, this one here, has the ability to actually, it's called the glutathione or S-acetylglutathione. It has the ability to protect, your lungs, your liver, and your kidney. And there are several studies to show that, if your levels of glutathione is actually, high, the impact of the symptoms is actually less, or even that is actually, not an issue. So that's why, again, that's something that you might want to look into. That is very, very important as well. Again, it's glutathione, and the thing is, not all glutathione are the same.
That's
because
right.
they're being destroyed.
That's the thing. You've got to have the right supplements.
It's being destroyed actually in your gut, so we recommend S-acetylglutathione, or you can actually take the IV. We have somebody who's doing that here in Rocky Mount.
Yep.
You can actually do an IV infusion as well.
Yep.
Another thing is actually melatonin. So most people, Miss Linda, thought that melatonin is only good for sleep.
Yeah.
Right?
I take it for sleep.
So that melatonin can actually reduce, inflammation. And this is actually something that, even children, is safe to use, there's actually, the 1 milligram, you can go as high as, 5-10 milligrams. So this is something that you can also use. Another thing that can also use for reducing inflammation is the fish oil, or SPM. The SPM, or specialized pro-resolving mediators, are actually higher version of the fish oil that can also be used, for that. So I just wanted to go back again. Why are those important? Again, we discussed about the zinc, for instance. So zinc, you can go as high as 50 milligrams to even 100 milligrams per day. So basically, the purpose of that one is actually, to prevent, or actually, minimize the replication of the virus. So that's mainly the purpose of that one. Vitamin D, you can take 5,000, because a lot of practitioners are telling to take only 1,000. You can go as 5,000 or even 1,000 for a short period of time, and that won't hurt you. Again, 5,000 to 10,000, it won't actually, hurt you just for 1 week. So basically, again, for those who have high levels of their vitamin D, it shows, your immune system will actually be better. Now, for vitamin C, you should be taking at least, 1,000 to 2,000 milligrams. The only way you would know if you're actually doing excessive is if you're starting to have diarrhea. Okay, so that's the thing with that one. And then the glutathione, guys, 100 to 200 milligrams, daily. You can take it, twice a day. And of course, you've heard also, using quercetin. So again, you can use also quercetin or even NAC. I'm sure you've heard of NAC. It actually helps to loosen, if you have congestion and if you have mucus, it helps, a lot with that. So there are a lot of things, but the only thing is, again, you need to have something that's actually very helpful in terms of, number one, you need to have the right dosing, and at the same time, the right product that's, best absorbed.
Yeah, that's right.
That's a lot, right, Ms. Linda?
Well, that's a lot, but it's true. And I'm a real supplement snob. I tell my patients all the time, I only refer to 2 places here in town. I don't tell anybody to go to Walgreens, Walmart, Vitamin World, any place like that. I know for a fact that Walmart does have a lot of supplements from China. I don't know what all their supplements are, but I made the mistake of buying turmeric. I was out of turmeric, which I take. It's an anti-inflammatory, and I take it. And I noticed after about a week of taking it that my knees still hurt, and they never hurt before like that. And so when I looked at the package, it was made in China. And so, their standards are much different than ours. And so I'm very skeptical of anything that comes from China. So I threw it in the trash and went to Patrick, and where I should have gone in the first place, and got my turmeric. So my patients are told to either go to Ward Specialty Pharmacy or to remedy this naturally. These guys make their living off of supplements, and if they don't sell good supplements and they don't help you, you're not going to come back to their store, and they're not going to pay their rent. It's just as simple as that. You've got to have a good relationship with your customers, and in order to have a good relationship, you've got to give good, honest service and good, honest products. So I'm a supplement snob.
Mm-hmm. Yeah, thanks, Ms. Linda. And again, guys, that's a good point that Ms. Linda actually mentioned. So we're a very unique business. So just to let you know, we are the only compounding pharmacy in the 45-mile radius, and we are actually a resource. She's right. Most people actually goes to us to seek information, and again, we in terms of information, we actually share that, because again, that's the thing that we can actually help our community. That's why we're called a resource of information. I know sometimes it's hard to get to actually talk to your doctors, and that's why we're here. In the community, we're not competing with doctors or medical practitioners. We actually, we try to help them, because they are busy folks. They're busy in their office, they're seeing a lot of patients, and they don't have enough time. And what we're doing is that, we're helping them in terms of explaining to them what patients are needing and what patients are talking. And if we need to actually, discuss that also with your doctor, we make sure that we reach out with your doctor and discuss those also. And in addition, we compound specific for your unique needs. We do both humans and pets. We specialize with bioidentical hormone. We specialize with any forms, for pediatrics, for pain. So we all do that. So just want to let you know, maximize, the presence of Ward Specialty Pharmacy, because we're here for you, and you have that. You have that in your community.
Well, and you and your wife are both pharmacists.
Yes, ma'am.
And you are always available. Diana's always available. You're sometimes available because you're a busy guy.
Yes, yes, Diane is also a pharmacist.
Right,
and
but my point is that when you go there, when you go to your regular pharmacy, and this is not a negative towards any pharmacist in any pharmacy in town, but they're so busy that they really don't have a lot of time to talk to you. And both Diana and Patrick will sit down with you and explain to you what they think you need and why. And so that's really important, because practitioners don't have the time, number one. And number two, I'm not, my expertise is not in drugs. I know enough about drugs to know what to order for a cold, or what to order for a urinary tract infection, or what to order for pneumonia. But when it comes down to the nitty-gritty of the drugs, how they work, what's in them, why they work, that's what the pharmacist is for. So take advantage. Even if you just have some random questions, go on in there and you will be delighted in the service, and you'll be delighted in learning something from them. So I just encourage that for you. And tell everybody where you are, Patrick.
Yes, we are right across from Harris Theater in Sunset, here in Rocky Mount. Our address is 3646 Sunset Avenue, Suite 110, Rocky Mount. And I just wanted actually to point that service. So one thing I just wanted to tell you, Ms. Linda, that you know that I'm not from here, right, originally.
Oh, really?
I came
Precioso, Ignacio.
I came from the Philippines originally, 10 years back, and this is actually my anniversary month, really. And I fell in love, in this area when Gary closed down, Ward Specialty in Nashville. First thing is that came to my mind is that where will the people actually get their compounding? So that that became a question. So that's why we're still here, and we're caring, we're taking care of people, because I know that there's a need in this area, and that's why I keep on telling most of the folks and most of the customers that my profession is more than my profession. This is a mission,
Yes.
So
yes.
And right now,
it's a real mission.
It's a real mission. Right now, it's a real mission. We've been helping a lot of folks. We've been trying to save more lives. And again, that's something really that's really awesome. That's why I said, this is real mission, that we have right now.
It makes you feel good, doesn't it, when you help people?
Exactly, ma'am. That's the most important. We're all here together in this community.
Right. That's right.
And it's like you don't want one family member to fall behind. So that's why we try to do the best you can. Reach out with all the the connections, and at the same time all our practitioners in the area. So again, that's something, if we work hand in hand together, let's not talk about politics anymore, or our differences.
No, let's talk about getting better.
If we we are a team here in this area, whether you're in Rocky Mount or in Nash area or even in Edgecombe, we are a team. The more practitioners that would be upfront and stepping up the plate, the more people that we will be saving. Let's not think about other communities who are not involved, but what I'm hoping for, Ms. Lena, is that everyone in our community, all the practitioners will be on their level, helping our community, preventing more people to suffer, and more people to even lose their lives.
Right. Well, we're going to talk about compounding pharmacies when we come back, because a lot of you probably don't even know what a compounding pharmacy is, what they do, why they do it. So we're going to talk about that when we come back. So don't go away, and we'll be right back. Now, we're live. Today is January 26th, And so you can give us a call at 407-1111 if you have any questions, any comments. We'd be happy to answer the best that we can. All right, don't go away. We'll be right back. Hang on.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Today, some of the world's most advanced orthopedic techniques and technology are available right here in the Twin Counties at UNC Orthopedics at Nash. Our team of specialists offers a full range of orthopedic treatment, including spine services, hip, knee, and shoulder repair, as well as joint replacements and rehabilitation. So don't just live with the pain and immobility. The best care anywhere is close by. UNC Orthopedics at Nash.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
So we're both live.
Hello, hello. Welcome back. This is Here's to Your Good Health. I'm Linda Prezioso. This is a new year for a new you for 2022. And so we are so thrilled that we have UNC Nash Healthcare, Voice Willis Clinic, and the Y helping to sponsor these programs so we can get the word out for good health information for you all. So I've got Patrick Ignacio with me. He's the owner of Ward Specialty Pharmacy. And I bet a lot of you don't even know what a compounding pharmacy is. So he's going to explain to us why it is. Why are they so few and far between? What makes them so unique?
Okay, so thanks for asking that. Again, we're a compounding pharmacy, and we are located, of course, here in Rocky Mount. We are the only compounding pharmacy in the 45-mile radius. So technically, I mean, when we talk about compounding, is that we're mixing a particular compound from scratch. So we started, we can actually do it in a form of capsule. We can do it actually in a form of different delivery system like capsule, powders, suspensions, creams, so on and so forth. So why are we doing compound? So mainly the reason we're doing compound is that if the product is not commercially available. So if it's not commercially available, that's one. Second is that if a patient has allergies to a particular ingredients, for instance. So that's another thing. And then if the person cannot actually tolerate a specific delivery system, for instance, she cannot swallow a pill, then we can actually convert that into a liquid form, or even to a suspension form. So another unique thing that we actually do is that we both make human compounding and at the same time animal compounding. Now, the beauty about compounding is that we have actually the flexibility, and we can touch on several, health issues, whether it's actually for pain, whether it's for bioidentical hormone, or for women's health, men's health, wound. That's the good thing about, doing compounds. Plus, what's interesting is that there's an advantage of making the product cost effective. I would give an example. There are products out there, for instance, for women use, like hormone. If your insurance is not covering it, it would cost like, $400 to even $500. But if you're compounding that can actually price between, $45 to $65, for instance. And that's one. Another thing that, that's very unique right now is, for instance, I'm sure you've heard of ivermectin, correct? So this ivermectin, if they're being used for something else, especially during, this pandemic, most insurance doesn't cover it, and they actually price between, and again, this is dose dependent, Miss Linda. So the price of that one ranges between $400 to $600 for the period that they're using it.
Wow.
But this can be actually purchased between $55 to $85 or even $105 for the full duration. So that patients save so much already. So that's actually the advantage why we are doing compounding, and what's the reason compounding is very important in the community.
Well, and there's certain things that I can't really get for women. For instance, boric acid. I send them to you for that.
That's funny because again, most women, it's for those who have vaginal issues. Most women sometimes would actually be prescribed with boric acid, and they can typically actually buy that in a powder form. But the problem is the right dosing. So that's another thing. You can't actually put the entire powder vaginally. So you have to have the right dosing for that. So we as a compounder make sure that it's the right dosing. And again, I would go back, I would pivot again to what we have, the issue right now, right? One of the main issues that we're trying to have is for those who are taking ivermectin, for instance, right? They're using actually, animal grade, and they're buying it, in a Tractor Supply or probably, somewhere else, But the problem is that's not the right thing. I encourage you not to do that because, again, you can overdose yourself, and that's the reason we have a lot of reports of, adverse events and, even probably, side effects and deaths. It's because, again, most people right now are doing that, that way, which shouldn't be the case. It's best, to go to their doctor, ask their doctor, and if your doctor are not, or your practitioner doesn't know anything about it, then they may call us. We try to collaborate and we try to work with your doctors on this one. So that's actually the advantage of having a compounding pharmacist.
Yeah, I had a patient who had knee pain, and she said, "Oh, long ago, Patrick wrote something for me, and I want you to get that again. He compounded something for her. So I called Diana and gave the patient's name, and she said yes, and she knew what it was, and so I was able to, it's a compound with ketoprofen, which is, I don't know what the difference between ketoprofen and ibuprofen is.
So, yep, I mean, there, again, the good thing about compounding, because again, if you would go to a regular pharmacy, there's only one topical, version, and that's technically, the diclofenac, for instance, or Voltaren.
Right.
So, but the Voltaren is actually, I think that's only like 3% availability. We can go as high as, 10% of the diclofenac. So we have the resource, and we can actually even mix them together.
Right.
Let's say, if you have neuropathic pain, we can actually put gabapentin in there. We can also put some amitriptyline, and we can use, of course, the diclofenac or ketoprofen, or if we need to put lidocaine. So again, that's the beauty of being a compounding pharmacist. We can put them all together depending on the situation. Again, we just don't like come up with something and that's it. We actually research this. We make a research. We have almost like 150 consultants, that we talk to and discuss if this is actually feasible for you. If you have allergies for specific ingredients, then we have to remove that. That's actually the unique thing about compounding. And guys, I mean, everything starts, all your medications started from compounding. Even, do you know that Coke and Pepsi?
Yes.
Actually, that's a popular drink, but it's a compounding pharmacist who started that one.
That's right.
Okay? So who knows, Patrick might one day,
maybe,
think of something, and then that would be, become popular. So hopefully, hopefully one day.
That's right. That's right. That's good. Yeah, I've got quite a few people that I send over there for various different things. And I was just thinking of a drug that you compounded for me, and it went out of my brain. I'll think about it in a minute.
And again, we do a lot, again, for those with pain issues, guys. Something that, to be rubbed on, especially now that, they're very particular with controlled medications. That's a thing. We can help you with that. If you're having some issues with hormone, mostly men, we can also do that with testosterone, making it more affordable. And by the way, I just wanted to also mention, ma'am, it's not the compound, but the CBD also. Guys, be careful if you're buying CBD. Make sure that your source is actually very compliant, because there's a lot of people who are actually buying CBD from everywhere. Please be careful if you're buying actually CBD.
I'm glad you brought that up, because I've got a patient who is on a controlled substance, and so we have a drug policy, and you get tested periodically, and she has marijuana in her drug screen. She swears it's CBD oil. So tell me how we can not have a positive drug screen.
Okay, so technically, again, using hemp or CBD is not marijuana. So I just want to clarify you with that. The only concern right now is that the only testing that we have is urine testing. If you're using urine testing and you're using actually CBD, there is actually a potential. And again, that doesn't actually goes only with CBD. There are several supplements and even medications that can potentially make you positive. Now the problem is that most patients now are resorting not with CBD. It's actually the THC9, which is common also. It's actually sourced through CBD. Unfortunately, the THC level is actually elevated, so that's why if they will be doing the drug testing, it would show up to be positive also. Right. And so the thing is, again, it's best if most clinics would actually choose a certain certain place, and then we could have the record of your patient, and then we can actually provide to make sure that these patients are really on CBD products and not on other illegal substances.
Yeah, yeah, because I'm probably going to have to drop her because
Oh, wow.
she's going to have to bring in documentation from wherever she gets this. She's a teacher, but she also works for a farm. She works on a farm every summer, when she's off. And she said that her farm makes it, and so I'm gonna have to get the information. I'm trying to keep her as a patient, but the documentation in my chart looks bad when it says positive for marijuana.
Right, and that goes not only for you, but for different clinics.
Right.
And again, I mean, because we are very particular of looking for the certificate of analysis, and not all, most outlets are really, keeping up with this certificate of analysis. So the certificate of analysis is very important because it tells you what are the components in, that particular product.
Right. Because I did talk to the director of our lab, I forget his name, some doctor, and I said, is there some way to differentiate between the THC in CBD oil and in an illegal product? And there is not, at least with that lab, and I'm sure he's up to the minute with that. So
unless, the protocols will be changed. If we will be using actually, the blood testing, the chances if they're using actually, CBD, even though with minimal THC would be negative. But if you're using actually, marijuana really or high THC component, then that would really show up.
Yeah, and it's a pretty high number in her.
Wow.
So I hate it because I like her and I believe her, but if I get called into court, that's not going to stand up in a court of law while I believe her.
Yes.
So that's just, I don't know even how I got onto that. But anyway, compounding, it's really important, and I like the fact that if you've got a child that won't take medicine, I mean, I had my last child, anytime I put medicine in his mouth, it went up. But Patrick can compound the medicine in a lollipop for a child.
Just to highlight that, good thing you mentioned about lollipop. Now most patients are having sore throat, right? So we can actually make a lollipop, and that, that can actually help in terms of, if you're having some sore throat, that would actually numb, if you have sore throat, especially because most people who have COVID are experiencing that there's like glass-like thing in their throat. So that contains actually, tetracaine, and that actually helps soothe and help also most patients who cannot eat.
Yeah. And I know I met a compounding pharmacist from, I think it was Cary, at a conference I was at. But yeah, they're very few and far between. I don't even know. Do you know how many there are in the state of North Carolina?
There are few. It used to be there's a lot of compounding, but because of the changes of the regulations, they're so strict right now. So that's why, again, we are very careful, and we are very ethical as much as possible, that we need to, because again, the regulation change.
Yeah, and that's only probably going to get tighter.
Yes, to the point that there would be, few and few or less and less of, this compounding pharmacy.
Well, it's the same with the mom and pop pharmacies, the small ones. The big companies are squeezing them out. They won't, like Blue Cross and Blue Shield won't give a contract to certain small pharmacies. They only want the big pharmacies, and so it's tough to be an independent pharmacist of any kind in these days. They want the big names that can have a lot more patients, I guess. I don't know what the reasons are, but it gets to be disheartening because the bigger you are, just because you're big doesn't mean you're better. And the bigger you are and the more busy you are, the less time a pharmacist has to talk to you. And people ask me all the time, well, what should I do? Should I do this? Should I do that? And I really don't like to answer because I have such a limited knowledge of drugs, and that's the pharmacist's expertise. So anyway, it's time for our next break, and when we come back, we're going to talk about more of compounding, and I'm going to move into one of my favorite subjects, which is bioidentical hormones. So don't go away, and we'll be right back with more of Here's to Your Good Health with Linda and Patrick. Don't go away.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Today, some of the world's most advanced orthopedic techniques and technology are available right here in the Twin Counties. At UNC Orthopedics at Nash, our team of specialists offers a full range of orthopedic treatment, including spine services, hip, knee, and shoulder repair, as well as joint replacements and rehabilitation. So don't just live with the pain and immobility. The best care anywhere is close by. UNC Orthopedics at Nash.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
All right, we're back. Welcome to Here's to Your Good Health. We're going to talk about, we've been talking about compounding pharmacy, and Patrick is an owner of a compounding pharmacy here in Rocky Mount, and we're really blessed to have him here because they are few and far between, and as he said earlier, he's the first one, the next one is at least 45, 50 miles away. And is there one in Greenville? I don't think so.
There's one in Greenville, but they're more on infusion.
Oh, okay. Mm-hmm. Okay, yeah. Before we get into bioidentical hormones, I wanted to ask you, what about these people that continually test positive for COVID, even though it's been 3-4 weeks?
Okay, so that's a good question. We've been seeing a lot lately that most people are still becoming positive, and we found out that these people can actually be positive for 90 days. If as long as number one you don't have fever, but the problem is each individual, each facility or each establishment has its own protocol. like if you're an employee, for instance, I mean, they want to make sure that you're negative. But the problem is, again, there's a potential that you can still become positive after a week, after 2 weeks, after 3 weeks. So the thing is, as long as probably you don't have symptoms, and the CDC guidelines keeps on changing also. So that's the thing. The only thing is, again, I mean, make sure to be watchful of the symptoms, because again, what you don't want is actually I mean, you are positive but you're ignoring it, and then you develop actually having pneumonia.
Right.
That's actually the scary part there.
Right.
So that's why we encourage invest on the pulse oximeter as much as possible, because again, if you have fever, I mean, that's an indication that your body's actually fighting out the
virus of some
right?
sort.
But the problem is you don't know, you cannot actually tell whether your oxygen level is dropping. So might as well invest on pulse oximeter, because that can help.
Do you know how much they are? I don't know.
So the pulse oximeter actually ranges from between 20 to 30, even depending. There's a lot of gadgets right now, depending on the whistle thing.
All the bells and whistles.
Bells and whistles.
Do they sell them? Do you sell them?
We sell them, but they actually run fast. You can, and again, I mean, buying also in Amazon, that's fine, provided that at least make sure that you know what you're buying.
Right, right. Do they have them in other pharmacies like Walmart?
I'm sure they do, but
do.
they're very quick. Again, you can go anywhere, you can scout anywhere, but at least invest on that one. It's very important. I mean, at least one.
You got to make sure your oxygen is exchanging properly.
House should have that.
Yeah, yeah. All right, so we're going to move into my favorite subject, which is bioidentical hormones. And as I've been doing my research and studying, because I'm very interested in this and treating more women with it, I had no idea that synthetic hormones were made from horse urine.
Well, again, I mean, there are products that are synthetically made, so that's the thing that you don't want.
Yeah, and tell me why.
Well,
other than horse urine.
Okay, so going back, let's discuss about the bioidentical hormones.
Okay.
So these are for women who are actually experiencing several symptoms of menopause, like I call them the itchy bitchy witchy thing. So if you're having symptoms of hot flashes, night sweats, irritability, vaginal dryness, and you're actually not having period, then that's a sign of you're going towards menopause.
Right.
And most people ignore this one. You shouldn't ignore this one, because again, this is a normal process, but the problem is that it can affect you. It can affect the people around you. It can affect your relationship with your husband, with your family, and it can actually even go both ways. Separation, even not so good relationships. So that's actually the importance of the hormones. And again, in taking hormones, make sure that you're taking actually the bioidentical hormone. But of course, you have options. Most doctors are using the other way. And again, it really depends. But the thing is, what you don't want here is the amount of the side effects that it can bring you later on, especially if you're taking oral bioidentical hormone. It actually helps, or it leads to an increase of it increases the chances of having cancer, breast cancer. So that's the only thing.
Well, in my studies, I've learned that number one, synthetic is a one size fits all.
Yes.
There's a couple of different doses, but it really it's a one size fits all. Whereas bioidentical hormones, you have a certain testing that will say exactly what is missing in your body, in my body. So what works for me is not going to work for you. You have to have your own. God made us all unique. God made us all different. And so we have to have that compounded just for us. And I can tell you, this is my own personal experience, and I've known Patrick a long time. He probably doesn't remember, but I used to buy bioidentical hormones in cream form when he and Diana worked at Ward's Specialty Pharmacy when it was in Nashville. And that was I don't know, when was that? A long time ago.
10 years ago.
10 years ago. And you know, I was fortunate to have a doctor that believed in that and would write the prescription for me. Some doctors absolutely will not. They don't believe in it. They won't talk to you about it. They are an absolute no. So that's one thing. And the other thing I've learned, well, a couple more things. I did a hormone test on myself and found out my deficiency. And Patrick compounded for me, and I'm getting my medicines from him. And I feel 100% better. I have much more energy. I feel more like myself. I feel more like almost a teenager again. My husband said, "What are you taking that you are all, I can't sit still now." And he said, "Are you on drugs or something?" Yeah, I'm on drugs.
And again, when we talk about the hormone, these are your fountain of youth. That's the reason why women are actually beautiful when you were young. And that actually, cracks my head when, patient would say, "Oh, it actually, I don't want that, I don't want to try it because, it causes, cancer."
Right.
Always remember, guys, I mean, if hormone is a cancer producing, then by birth, you should have cancer already, right? Because you're
full of hormones.
You have full of hormones.
Right.
You have sufficient amount of hormones.
Right.
And right now, I mean, for those, if you're menopause, you're actually, declining in terms of menopause.
Yeah.
You're just supplementing. The problem is, again, if your level, if the type of hormone you're using is actually synthetic, then there's a big chance. Now, hormones is everywhere. It's in the air. It's in your makeup. It's in your food. So don't just blame, your bioidentical hormone, because again, they're not the in all reason why people are actually having the cancer. Thing is, if you have problems with liver, if you have fatty liver, again, that affects so much. If you have liver issues, that affects your chances of having cancer, because you're not breaking down or you're not metabolizing all the hormones that you have in your body.
That's right.
Right?
That's right.
So by the way, Miss Linda, I just wanted to add, guys, I mean, for those who are having COVID, I just, thought of this one. If you guys have, more liver issues, you're more prone to having, severe symptoms. And it's actually, written in PubMed. I mean, you can check it out. So just be careful with your liver also.
Yeah. And the other thing I learned about bioidentical hormones is it really helps 3 factors in women, and one is osteoporosis.
Yes.
And one is in your chances of getting Alzheimer's are less because of that. And I forgot the third one.
So it helps a lot of things. If you're gaining weight,
yes,
you have
it helps
problems
with weight.
hormone. Of course, I mean, she mentioned about the memory, the blood pressure and blood cholesterol issues is another thing. And again, I mean, for those women who are having some vaginal issues, having infection or vaginal thinning, it's a hormonal thing also. But more so, again, people are using, by the way, over-the-counter products for this one. There's a big difference. If you're only addressing, hot flashes, night sweats, then you can go with over-the-counter. But if you're addressing more, if you're having problems with hair, if you're having problems with bones, if you're having problems with skin, if you have vaginal issues, again, the bioidentical hormone or any form of hormone is beneficial for you in the long run.
Right.
And again, you wanted to feel beautiful inside, right?
Yes.
That's what most women are. If you want to feel beautiful inside, then you have to fix that balance. It's a perfect harmony.
And I'll tell you a story. I saw a patient today, and she said, "Well, I thought I saw you last year for something, but I saw some old lady that had back surgery." And I said, "That's me. I had back surgery last year." And she said, "You look so different. You look so much younger." And I swear it's the hormones. So, you want to look good and be younger. Now, if I could just get rid of the wrinkles, you have a cream for that.
It's a collagen. Yep. So and again, I just wanted to address that also. if your doctor are not familiar, we're here to help and we're here
Right.
to work with your doctor
Right.
or your practitioner, okay? Again, as I mentioned, we're not competing with any doctors in the area. We're here to collaborate with them. We take away that particular time so that we can actually, help you with that, and then we report it to your doctor. So that's actually how the process goes. We actually were removing that hour of, consult, and then we also report it to them. So that actually collaborates you, me, and your doctor. So we are a team here.
Yep, I work very closely with Patrick, and I'm very fortunate. I've got his number, and I can text him and say, this patient has this, what should I do? And he'll tell me what to order, and then I can write a prescription for the patient. So I'm a big believer. You all know, you've watched me long enough to know that I'm all about natural. I'm all about what God has given us, and hormones are, the hormones that Patrick uses, I believe, are mostly plants. Is that correct?
Yes, those are actually plant-based.
Right. So you're not going to have a reaction towards a plant-based like you would some of those synthetics. So I'm just really excited that we can be doing all of this. I'm so excited that we have a compound pharmacy here in town that can help us with specific problems for for people that have specific problems. We can pinpoint and get right to it. He can make, like he said, a stronger topical pain medicine than you can buy over the counter. And I know I was going to say, and Naltrexone, is that right? Is that how you say it?
Naltrexone.
Yes.
So again, if you
because low doses are very beneficial, but
Right.
regular pharmacies do not have the low doses.
So thanks for mentioning about that. Again, we do low-dose naltrexone. If you're having autoimmune issues, again, there's several references. My gosh, I have a patient, we have a customer who's been having some Crohn's or IB issues for a long period of time. He's having, severe diarrhea like every day. We started putting him on low-dose naltrexone, and my gosh, it's amazing.
Yes.
He said for the first time in his entire life, that manages the issues.
Yes.
So again, guys, if you're not familiar with low-dose naltrexone, I want you to start researching on that. Low-dose naltrexone. It does an amazing, things if you have autoimmune issues.
And naltrexone is the medicine that they give you if you overdose. So isn't that the same thing?
Yeah, so yes, but the only thing is it's 50 times lower. Again,
Right.
low-dose naltrexone is 50 times lower than your regular naltrexone.
Right.
And again, most doctors thought, it's the low-dose naltrexone is something that, that's an opioid. Again, it's not an opioid.
An antagonist, isn't
It's
it?
very safe.
Yep.
I shouldn't be saying that, but it's comparatively, to most supplements, it's like that.
Right.
So
Great for pain.
Yes. And again, for autoimmune, if you have any, if you have time, Google that. It's low-dose naltrexone, and talk with your doctor about it.
Because he told me about it, I didn't believe him. I should have believed him, but I didn't. And so then I read about it, and it's absolutely right. And then a patient came in, and I felt like that patient would benefit from it, and I, sent the prescription to, I don't know, it was a, regular pharmacy, and they called me back and said, we only have this in 50 milligrams, and see, but Patrick can break that down into what the patient needs. So. Anyway, our time is up. Thanks so much for watching. Thanks so much for joining us. And we'll see you next week with more of Here's to Good Health. Patrick, thanks so much for coming. Even if it was an hour.
I know, right? Thank you, guys. And again, if you have any question, feel free to call Ward Specialty Pharmacy, 252-459-5544. You can go to Facebook also. We have a messenger there. If you have any question, you can reach us. You can reach us through that. And we're glad to work with you and help the community.
That's right. That's right.
We love you all.
Make us better. Make us more healthy. All right. Good night, everybody. Thanks so much for watching.